21st of March, and we're here at the Ealing Broadway Hospital attending a protest arranged by the Socialist Workers' Party. And essentially we have here a group that's comprised of people from the community. And this is a very strongly ethnic-based community. We're coming here today to protest the closure of the Charlie Chaplin's school ward. 21st of May, the GNB, WRP and Young Socialist Party organised a protest against the closure of the Charlie Chaplin Children's Ward. The 50-strong group began their march at 1 p.m. Beresford, marching through Southall Broadway, then settling at the main entrance of the hospital.
The health of a nation depends on young doctors.
We pay so much tax, and we like to open the Ealing Hospital.
I spent all my life working in an NHS. Look at what they have done today. I'm not happy what they're doing.
No, we know.
You know?
Congratulations, everyone, for marching and fighting to save Ealing Hospital. The fight is just beginning. We're not going to let this hospital close. We're not going to let them close the children's services. They intend to close the Charlie Chaplin Children's Ward on the 30th of June. And on that date also, they intend to stop children being treated in A&E.
Having already lost their hospital's maternity ward and coupled with the planned closure of the A&E, the community is in fear that the government's plan to shut the hospital down will go ahead unless they take a stand. For many, their desperation at potentially losing vital medical resources is a case of life and death. If plans to shut the hospital get the green light, people living in Ealing Broadway will have to travel up to 8 miles to the closest hospitals.
This is the only hospital we got in the area. The last time they closed the maternity ward, now they're going to close the children's ward, then an accident emergency. These are vital services, and if you take vital services from a hospital, you got nothing left. All because of privatization. They want to gradually bring the American system where people are forced to take healthcare, private healthcare. So it's sort of increase, you could say, commercialize health, where we feel that health is a fundamental basic right. We pay taxes, and it's our right to have quality healthcare for our community. This is a socially deprived area. Why, particularly in this area, they're closing the hospital? The other thing I like to say is that where is the democracy? We had over 100,000 signatures from our community in the petition. They've ignored. We've had the town halls full of people in meetings. We've had marches. Why is it that the voices of our community are being ignored, and they're so adamant in going ahead with the plans of the closure of this hospital, all to serve private interest, so their profits go and our community is suffering? Can you put value to human life?
So the findings at the end of the day, with regards to this protest against the closure of the Charlie Chaplin's Children's Ward at Ealing Broadway Hospital, is that a lot of people, especially from the ethnic group within the area, feel really passionate and really unhappy with the way that things are being dealt with their local hospital, because they've already seen the closure of the maternity ward, and they are being under the threat of a closure of their local A&E. In the future, if their hospital does close down, the only other 2 hospitals that they have are 8 miles away from their current location. And the feeling that was expressed by many of the people who we interviewed and who we saw on that day is that this is a life and death situation. The closure of all these hospitals is putting more pressure under the NHS and under the existing hospitals who are not sort of being affected by these major cuts. And the people are simply not happy with what's being done. They're not happy with the way they're being treated. They're not happy with how it's going to affect their local community, because obviously, as I've said before, the community in that area is a very highly densely populated and has been growing. And so the fact that they're wanting to close all these wards, which are so vital and have been so efficiently working, is seen as ridiculous.